But all because you put fat in your face, it doesn't necessarily have benefit.
Is being in ketosis useless? Hi, I'm Dr. Eric Westman and welcome to my channel where I review and debunk nutritional misinformation online. In this video by Dr. Cywes, who I know pretty well actually, he talks about the difference between ketosis and fat adaptation, and even suggests that ketosis isn't really that important. It's the fat adaptation. Well, wait till the end to see my final thoughts. Let's see what Dr. Cywes has to say. Before we dive into today's video, I want to invite you to my free webinar, Beyond Cholesterol, the 2 biggest risk factors for cardiovascular disease. If you're confused by cholesterol or feeling pressured by your doctor to take cholesterol medication, this webinar is perfect for you. Discover the crucial facts about why cholesterol isn't the primary concern for cardiovascular disease risk, and learn what you should focus on instead to evaluate and lower your risk. You can sign up below.
Hi folks, this is Dr. Rob Cywes, the Carb Addiction Doc. And today we're going to improve your understanding of the entire ketogenic space. And there's something that most people don't quite grasp or understand, and that is the difference between ketosis and fat adaptation. Huge difference, so important to understand as you move away from doing a diet, which is a terrible thing to do, and make this a way of life.
Always consider the source of the information, and I would say Dr. Rob Cywes is extremely qualified to be talking about ketosis. And yes, he is a surgeon, but I've met Dr. Cywes. We're actually on the same board of the Society of Metabolic Health Practitioners and have spoken at meetings. I've gotten to know him pretty well. And he's super smart. He has a PhD and is a surgeon and treats people for medical obesity and medical management of and reversal of chronic metabolic conditions. So he's really, really qualified, not a research scientist who's publishing papers about these things, but actually using the low-carb and keto diet as an adjunct, or the surgery as an adjunct to the whole picture of treating the people that go see him. So let's see what he says about ketosis and fat adaptation, why they're not the same thing.
Ketosis simply means having ketone bodies in your bloodstream. Now, ketone bodies are a fuel currency. They're a form of energy. They're a molecule made up of fat, beta-hydroxybutyrate, a subset, a little tiny block of fat. Think of it like pennies are ketones, and the dollar, the big card, is fat. So when you break the dollar up into little pennies, those are ketones. And when you increase the amount of ketones in your bloodstream, that's called ketosis. I could sit here and drink 8 ounces of olive oil and get myself into ketosis. And you can measure that by pricking your finger or by peeing on a stick, and it's called peeing purple or being in ketones. Keto Mojo is a great device that gives you both your blood sugar and your ketones. But all because you put fat in your face, it doesn't necessarily have benefit.
See the difference already. So just drinking oils, olive oil, coconut oil, medium chain triglyceride oil, even ketone drinks will raise your ketones momentarily or for an hour or two, but it doesn't mean you've adapted to fat burning. So what he's leading here to is, unless you change the diets, you're not going to get to the fat adaptation. But the interesting research, probably since this video has been done though, there is some possible benefit of just drinking the oils or the ketones, and that research is ongoing now. But the idea that you can get ketones from your own body fat is a very important concept. You don't have to be drinking the ketones to get ketosis. You can get momentarily or for a few hours the ketone levels to go up, but that's not the same as being adapted to fat burning. I think that's a great point.
In fact, if you can be on a zero carbohydrate or close to zero carbohydrate high fat diet and you initiate that slowly so that you don't get keto flu and you don't have the rashes and all the other things, you slowly introduce that to your body and you slowly, over the course of about 3 or 4 or 5 or 6 weeks, transition from being a sugar-based consumer to a fat-based consumer. And obviously protein comes along with fat. I'm not talking about protein. It always comes along for the ride. You can slowly transition your body to be in ketosis in a happy, healthy way, where you don't get keto flu, you don't get keto rash. And for those people out there that say, oh, there's no bad thing from cutting out sugars. Yeah, when you cut out sugars, you get the keto flu. It's miserable.
Well, I don't have quite the same experience of everyone getting keto flu and it's miserable. In the program that I use, most people don't get the keto flu. I think he's trying to just give a little drama there about the changing from carb eating and carb burning to not eating carbs and fat burning. Most of the time people don't get keto flu, but anyway, the main point there is that there's a change that's going on, and I wouldn't say it's as big a change as going from regular gas to diesel. That would mean an entirely different engine, but it's using different enzymes. You use different enzymes to burn the sugar, and you use different enzymes to burn the fat. And because we don't store the sugar, we store fat, you have to burn through the sugar first before your body's going to burn any fat. And so I think it's good to think of the sugar burning and the fat burning as two different types of furnaces or ways to use molecules to get energy. The carbohydrate burning is going to turn off the fat burning for a while or reduce it significantly because we don't store carbs, we store fat. And we turn any extra carbs that we have into fat for storage.
If you do it slowly, you can transition into ketosis. And now, as your cells become more and more exposed to seeing ketones in the bloodstream as a fuel source, those cells that can use ketones begin to use ketones more and more, and they downregulate the enzymatic pathways that burn sugar, and they upregulate the pathways that allow ketones to get into the cell through receptor-mediated channels, and they upregulate the use of fat preferentially as a fuel source. But that takes time. That's called fat adaptation. And the way we can measure that transition, where the cells preferentially no longer use sugar but prefer to use fat, we measure that by checking your insulin. Because insulin resistance is what the body uses to protect itself against sugar. There's a whole video on that.
So that's a pretty interesting switch, right? You don't know if you're in fat adaptation by checking the ketone level, because you could just be drinking ketone or an oil and the ketone can go up momentarily. You actually check the insulin level, and when insulin is really, really low, your body gets access to the fat burning. And that's very interesting to hear that kind of switch. I think it would be good to have both, actually. The ketone being elevated shows that your ketones are around, and the low insulin level means you're fat adapted. Well, and then if you're not hungry, that also, on the mark of the side of being fat adapted, you're losing weight, means you're fat burning. But the actual getting to know when you're total fat adapted, it's not really easy to describe, but it takes time for sure.
As your insulin numbers come down, it means your cell at first is not afraid of using, and afraid in cells but it's not trying to protect itself from flooding itself with sugar. And as your insulin content comes down more, it means the cell is using fat more often. And it doesn't matter whether fat comes from your mouth or from your own fat cells. If you're trying to lose weight, then the ketones primarily should come from your own fat cells. And the most important thing there is not to eat carbohydrates and slowly lower that insulin amount. At first, you feed yourself fat on a high-fat diet, which maintains ketosis, because you're still so insulin resistant, that fat struggles to get broken down from your own fat cells. Remember, insulin blocks the mobilization of fat. But as your insulin levels come down, now your body will use its own fat more readily. So at first, you want to be on a close to zero carbohydrate, high-fat diet to introduce yourself to ketosis. And you may not lose weight awfully rapidly. You lose a little bit of water weight to begin with. But then it stagnates a little bit. And then as your own insulin comes down, because it's your cells are no longer trying to protect themselves from this overwhelming sugar in your bloodstream, now you're able, because that insulin level comes down, to loosen up and release fat from your fat cells.
So did you catch that? So insulin, which goes up as a result of eating carbohydrates and can stay up all day long and then lead to insulin resistance. The twist here is he's saying that insulin resistance is actually a mechanism that your cell uses to protect itself from too much sugar. And I totally believe in that explanation. Insulin itself is really kind of the cause for insulin resistance. Hyperinsulinemia, or elevated insulin levels in the blood, actually causes the insulin resistance. The cells don't want the sugar, they become resistant. Don't want, again, as he says, a weird term, but they've had enough sugar pushed into the cell, so insulin resistance is a way to say, no, I don't want any more sugar, more glucose, much like your ears will downregulate or adapt to a very loud environment so that it doesn't seem so loud. Your cells turn off its ability to take in the insulin, and which helps take in the sugar. So insulin resistance, to measure it, you can check an insulin level, and if it's over, say, 5 or 10 or definitely 15 or 20, these are units in the US, then you have insulin resistance. And when you get the insulin really low, it allows your body to access the fat store and to burn the fat that you've already stored on your body. So the insulin resistance and fat burning really go hand in hand.
So the transition is away from eating fat to now using your own fat if you're interested in weight loss. And then hopefully when you get to a normal weight where you don't have a lot of fat to give, then you want to start eating fat again. So it's important to consume a high-fat diet to begin with to drive ketosis, and then on the back end to eat fat as a fuel source because you don't want to use your muscles. And then in that in-between time, you want to have a little bit of fat so that you're not relying on gluconeogenesis for fuel. But most of your fat needs to come from your fat cells, and that's how you accelerate weight loss. Fat adaptation is measured by a very low level of insulin.
Again, consider the source. I highly value people who are in a clinical setting, like Rob is. And I can't say how important it is if you're not having success and results from Google University, Dr. Google. See a practitioner who can, like Rob and like I do, can sit down with you and go over these things. Every week I learn something about the nuance of doing the diet or something that makes it not work, that it's very difficult to know what's relevant by looking at some things over the internet. So there's no substitute for, in the presence of a doctor who's trained this way, to help you figure out what's going on. And I find that people who are watching me, you may be watching me on YouTube, not one of my patients. Many people are traveling to see me in the clinic, and then we figure out what's going on, and it may be something that you don't think is relevant at all. A prior surgery, a prior medication, anyway, here we get to see some lab tests, again, from a doctor who's in the clinic. Dr. Cywes is in West Palm Beach, Florida.
And I'll give you an example. I've got some blood work here, which I'm going to go through. I'll show you what fat adaptation looks like. And this is so important for our diabetics. I'm going to pull up, I've got a bunch of blood, because we've done over 30,000 sets of blood work, and I've got a whole bunch here. These are by permission from the patients. So here's somebody who is in fat-adapted ketosis. The person is skinny, normal weight actually. And what's interesting is, if you just look at her lipid profile, triglycerides are 45. Below 75 is where I want them to be. Her triglycerides are at 45 because that's really how she transports sugar that's being converted to fat. Her HDL cholesterol is 90, above 75. That's about as intravascularly healthy as she can be. But her LDL, oh my God, it's 268. Most doctors would be having a heart attack on your behalf. No, in the face of a low triglyceride, high HDL, those lipids are fine. What is she doing? She's in fat-adapted ketosis. She's transporting fat from her fat cells to her tissues because that's what she uses for fuel. Think about this. If you stick a needle in your car's fuel line that's going from the tank to the engine, and you measure a lot of gasoline, and let's say you've got a diesel car, or actually, if you measure gasoline, that's fine. You stick it in there and you measure diesel. Oh my God, it's a gasoline engine, it's going to destroy the engine. So all you're doing when you're measuring your lipids is you're sampling the fat in your bloodstream. And if the fat comes from excess sugar being converted to fat, that equates with harm. It's a marker of harm. But if you are in fat-adapted ketosis, you want your fat to be high. The worst thing she could do is put herself on a statin, be that as it may. So she's just transporting fat from her fat cells and fat from her diet to her body as a fuel source.
Did you catch that? So when you're fat adapted, the molecules, particles in the blood are different. This makes sense. You know, if you're traveling from the Earth to the moon, there are some things that are different. Different gravity. You hit a golf ball, it goes a mile or a long way because there's not as much gravity. So when you're fat adapted, the LDL goes up because it's carrying your energy around, and of course you need cholesterol. You don't want to drive cholesterol down to zero, although a lot of doctors think of it that way. But when you're in a carb eating and you're turning carbs into fat, these molecules, the lipids, look and behave differently. So a high VLDL or high triglyceride level coming out of the liver is representative of you turning all that extra carbohydrate into fat. And that VLDL gets cascaded down to LDL and small LDL, and those are the ones we worry about. Even in the old paradigm, the new paradigm is small LDL cholesterol. And now if you're fat adapted, the LDL itself is different. It's typically large, light, and fluffy. It's transporting different materials around, and you're running on a fat as fuel economy. Typically, on balance, that HDL goes way up, and even in the old paradigm, HDL is thought of as the good cholesterol. The higher it is, the better. So this is an excellent review of someone who we call now a lean mass hyper-responder, who has a high LDL in response to a low-carb keto diet, but they also have high HDL, really low triglyceride, their abdominal circumference is normal, their blood pressure, their blood sugar is normal. It's treating the metabolic syndrome. That's the name of this constellation of symptoms. This is more important, and to not have diabetes is more important than worrying about the LDL cholesterol. Historically, and as we go forward, as new science emerges, we'll learn a lot more about the relative importance under the different circumstances. Whether an LDL is bothersome or worrisome under low-carb conditions, we suspect it's not as worrisome because it's a different type of LDL, the large, light, fluffy LDL, not the small, dense. And we are seeing now early research of people who have high LDLs for years, super high, up to 580, and they don't have any evidence of coronary atherosclerosis on really good scans. So that's a great interpretation of the blood tests of someone who is fat adapted. The trafficking or the carrying of the molecules are different on these particles. And like checking the fuel, did you catch that? You're not using diesel as the fuel. You're using a gas engine. You're not using diesel. So that was the quick metaphor that right now, when you're fat adapted, you're not using the carbs, turning them into fat, sending them to the fat cell in the blood anymore. That's not what you're using the bloodstream for. You're using the LDLs to transport different particles, the fat-soluble vitamins, the other cholesterol and fat and nutrition that you need throughout the body. So it's a different metabolism. The markers that we typically look at really don't mean the same thing.
But all too often we try to get ourselves into ketosis to lose weight. Weight loss only effectively happens and sustainably happens after you're fat adapted. And it takes between 3 and 6 months. It takes between 3 and 6 months to get adequately fat adapted. Where your insulin levels are low, you become insulin sensitive, you don't feel hungry, and your body preferentially uses fat, not sugar. And that is such an important concept to understand. So if you're on some little diet that lasts for 8 weeks, or you're doing a study that compares two populations. I saw a really nice study the other day comparing people on a high-fat diet and people on a low-fat diet, but the study lasted for 2 weeks. It lasted for 2 weeks. That's like having a fart, not a bowel movement. It gives us some data, but it's not congruous with what we're trying to do, which is a way of life.
So now I guess I would shade it just a little bit. You can get results. You can get diabetes reversal and you can get weight loss well before you're totally fat adapted. I think the point here is that if you want the benefits of fat adaptation, it's going to take 3 to 6 months for maximal muscle utilization. We saw that in a movie called Serial Killers 2, where these husband-wife team triathlon champions were put in a rowboat and they rowed from San Francisco to Hawaii after becoming fat adapted under the supervision of one of my teachers, Steve Finney. If you haven't watched Serial Killers, Cereal, or Serial Killers 2, these are great documentary films about elite athletes using low-carb and keto diets to improve their performance. And in that Serial Killers 2, it took 6 months for them to fully maximize their fat utilization. Then they went into the rowboat. It's really kind of a heroic kind of exercise, but if you watch the movie, you'll understand what's going on at a deeper level. But yes, you can be in ketosis very quickly. It doesn't necessarily mean you're fully fat adapted. That's going to take more time.
If you can get into fat adapted ketosis, fat is the place to be, and it takes time, it takes consistency. It has to be a way of life. And the only way to do that is to drop the word diet from what you're doing and use an addiction model where you're making binary changes.
So I like the video. I like Dr. Cywes' approach. He is super intelligent. I make fun of him at meetings sometimes that he can't be a surgeon. I mean, he's not your stereotypical surgeon, but he's PhD as well. He's just really into the metabolism as well and incorporates that into his practice. The main point here being ketones in the blood doesn't necessarily mean you're fat adapted. And I teach people that you don't have to be in keto forever. Rob's making the argument that if you've had a problem with addiction to carbohydrates and they just keep sucking you back, then you probably want to make the decision to become totally fat adapted and not eat carbs for the rest of your life. I don't say that that's a requirement for people coming to me. I explain it that there's a weight loss phase and a weight maintenance phase, and you can lose the weight and maintain it in any way you want. Of course, my preference, and over time I'll introduce people to the idea that you can stay keto or low carb for a long time, but I don't insist that everyone do it. In fact, in my book, End Your Carb Confusion, we match people to different carbohydrate levels as best we can. And so I don't think yet that everyone needs to be in ketosis or needs to be fat adapted. Some people, for maintaining a healthy weight and staying away from addicted substances like the sugars and the starches, some people do need to be fat adapted forever. And that's an individual decision that we can help you make. Any obesity medicine or keto medicine doctor can help you make. I hope that's helpful. If you like, please like, subscribe, ring the notification bell, and be sure to look out on Wednesdays and Fridays for new content. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.